All right, so we're gonna start Bumi's second day of stretching. I'll adjust the camera as we're going for everyone, but we'll have again. Well, these will all be up on Coach's Corner again, so we'll keep broadcasting them, and then we'll move them over to YouTube when we get home. Miss everybody who's not here, but if you are here, come on up. We got Coach's Corner going all week, lots of classes. You can find those on the discussion group. And look forward to seeing you or meeting you. All right, we'll start in a second. Anyway, which way would you like to face? I mean, my problem is you put fighting in the background, and they're all going to be watching the fighting and not the other piece. So, how about here? All right. Except, let me turn that around so I could see it. Sorry. Yep, we're going to go that way, and I'm going to make sure that make sure I'm adjusted the correct way. Technical, I know. I'm sorry I'm getting everybody seasick.
I will try to entertain you with noise. I noticed it wasn't as tight.
Well, this one you have to tighten up in a number of different ways. And next year, this will be much better. Yeah. All right, we're set.
So we're going to move back probably because you can't see his upper. Oh, we can.
As we yesterday, everybody, circle up who wants to participate in the stretching. Just come on over. We're going to warm up together. Get our shoulders on. Yesterday we talked about lower. Today we're talking about uppers. About back release. The big three things yesterday we talked about making sure that we stretch. It should be intense. It's not a gentle thing. It's intense. Your last rep on a heavy stretch because it's
I was just about to do that. And we're going to talk louder.
Secondly, we talked about passive versus active stretching, right? Using external force to help you pull you in the direction versus the muscles that it takes to pull you in the direction. And using both to get the maximum out of your ability work. And then other than that, really honing in on the idea that your body will adapt to whatever stretch is on it. And that's what they always take into today. So, we got 5 folks here. I want everybody to grab a spear or the great sword. You have one, a half, or whatever. I'll just grab mine. Yeah, there you go. I have a long sword for sure. That's fine. So I want to go over just my preferred first warm-up. We're going to do a staff overhead. So your goal is to bring this over your head, like you said. But a couple of points. I want you to make sure you're straight up. And so the work is going to be in your shoulders. As the staff is here, I want everybody to run up. As the staff is behind you, I want you to squeeze your shoulder blades so loud for your hands to go through. The wider you are, the more easier it is on your shoulders. The closer you are, the harder it is on your shoulders. And your goal is to make it a full range of motion. If I'm just warming up, I have my shoulder blades. Right here, I'm going to elevate, retract my shoulder blades. Do an external rotation. Right? If you cannot bring it back, widen that grip. Yeah, that. Yep. Now, notice a lot of people have trouble with their external rotation. You're holding on to the bar. You can feel your arm being kind of twisted backwards as you come down. Remember, you have to keep straight arm, no bend. And as you warm up, you're closer and closer. Good scapular elevation, scapular retraction. And what you should feel ideally is there should be like pulling across the front of your shoulder over, especially somewhere right here, staffing in this range. It's usually a part of these are the arm. You only get so close before you have to bend your arm, and that's where you stop for right now. Yeah, we're going to go a few more pieces. If you can, try to stay tight to the see on the way back, we've got bend to the back. And so that means that going a little bit slower, trying to be in that spot in front. And like I said at the beginning, it should feel intense. It's not it's not a gentle thing. It should be like, oh, that's a couple more, please. go to. I'm gonna warm up. I'm just good at that. Give it a try. Oh yeah.
And then I can see it. Okay.
All you're doing is widening your grip, straight arms, elevate, and then retract your shoulder blades. No bent arms, straight arms.
I tried.
You gotta keep it locked down for the purposes for it to make it work for both. Oh God! If you can't do it, then wind your grip a little bit more. Yeah. And try again. Yeah, you roll still, turn it over, if you can't, yeah, there you go. You're trying to find your butt. Like I can tell you have trouble with external rotation. You can go back to make that happen.
Some of the shoulders have been repaired, the other one is...
Yeah. So for everybody here, I'm presuming that everybody here armored fights, you know that your shoulders take a lot of abuse during this activity. And so what we're going to talk about today is kind of how shoulders operate, as well as some of the stretches that I use for this. So that's just one stretch that we're going to use. Let's do another one. Go ahead and put the staves down, the spears down, wherever you want. Next thing we're going to do, we're going to work on external rotation. A gentle version of this is putting one arm forward, and you're going to rotate it externally. This is passive stretching, pulling to the outside of your person. If you're like, oh, that's not too bad, that's a pretty good external rotation. Hold your hands in front of you, flip them like this, interlock your fingers, low towards your chest. This is a lot stronger for the external rotation. You have it out, you're here, cross, interlock towards your chest. This is good external rotation. You want to try whichever arm on top is the one that gets to work in this particular. This is the more difficult version of that same thing. Doing this.
Overcoming a thumb injury, so
as always, the precursor to exercises are not a licensed medical doctor. Don't pretend to be. And then secondly, listen to your body. Right? Listen to your body to make sure that you kind of hit what is good for the stretching shoulder or for your arm, but not
software, not hardware.
Yeah, exactly. Yeah. That's it. All right. Next to do. One of my personal favorites, full armored fighters. We do a lot of work that involves our front down, right? That includes holding shield like this one, right? Or anytime you're pushing forward, it ends up being some combination of techniques front down. It's very rare that we go back. So what we're going to talk about next is a high-low stretch. This one, I want to pack out. You can use your staff, you can use a rubber band. I want to show it with a rubber band. We want to grab the try it. I'll pass them out, but the end goal is this. You're going to have one arm high, one arm low. Right. One elbow high, and the other one come up high. It's like getting that low. This is stretch, right? Most often it's like you get arrested, you get that arm behind you. That's the idea. You can use your spear, you can use a band. If you are flexible, you can also get the band. That's the deal. So I want everybody to give that a try.
Not an armor. I shoot with one arm, and the other arm I can't.
What you're going to do is listen to exactly that. Right? If there's an asymmetry between the two sides, it tells you one side's tight. Turn around. Makes sense? So this is Yep. Right, that's one of the, but what happens is we, as sword humans, we end up using these front delts so much that it's hard for our arms to do this. Right, this is something you lose, and you don't gain it back unless you put in the work to get it back. And as we talked about yesterday, if your muscles aren't stretching, then what you lose is when it needs to stretch, it's put in a position that needs to stretch, something explodes, and we don't want that. Shoulders are particularly finicky because they aren't attached by anything other than muscles. It's just ligaments and tissue holding your shoulder in place. Do it on both sides. I remember that. For every sword fighter here, my suggestion is you want to work on ultimately getting your fingers to be able to interlock to some degree. Yeah, right hand back is very
So Master, with the staff, you're pulling upward and downward.
Correct, you're working both sides of the bow. All right. Yeah, your sword was a good question. Yeah, exactly. Yeah, sword. That's perfect. Oh, that's good. This is the hard work that doesn't get the glory. Right? This is the stuff where you're like, oh,
What was the
allows
question?
me to be able to swing and hit somebody.
Pulling up and down.
Without hurting myself. And then both of them. All right. So, those are just a couple of stretches that I personally use. We're going to talk about the potential movements of your shoulders. We're going to talk about how to test them today. So, everyone, I can do a staff or a sword too. What I want you to do is to hold the item in front of you with one hand, palm up in a supinated fashion. All right. So, what we're going to do is this. You're going to hold this weapon like this in front of you, and we're going to lift up. Keep your arm straight. And you're going to see how high you can bring your arm before we start to turn. You see how I'm starting to turn a little bit? While keeping it straight up. What this is testing is called shoulder extension. Right? And shoulder extension tells you how tight you are or how able you are to bring your bicep by or past your ear. This is another often weak point. So if you look at the example here,
He's the right guy.
what happens is this. As you're trying to bring your shoulder up, no more room. You feel it, no more room. And so they have to give it the back and then bring the shoulder down the hand. And what it's supposed to do is what's called power coupling difference. The idea is that their upper lats are probably way too strong compared to their low chest, which is what it takes to pull this up. Right? That's the issue. So we're stretching and loosening these big muscles and then strengthening those low muscles there.
And you should talk to him how to do that later, so specifically to work on.
And it's a really that gives you a lot more mobility in terms of your like when people talk about never bring that elbow like after people talk about don't bring that elbow above the back or those kinds of actions. If you are tight there, injury happens trying to do this. But if you are loose there, it's not a big deal to do this. It's like when you're a little kid. Yes.
Is this also working with posterior deltoid?
No, it has a little bit of post delt, but it's not specifically that. And we'll get to that in just a second.
With the stretch, as it begins to turn, where do you want to limit the stretch?
Oh, that was the last thing we just did is not a stretch. It is purely a test.
Measurement?
Yep. If you can get the ideal version is that you can get your hands all the way vertical, bring like a straight line between elbow to the shoulder and shoulder down to hip. That's the goal. If I can do that with a supinated hand, that is peak version. But if not, that is that's something to work for. Exactly. That's what you're listening for. Yeah, and you can feel how quickly that turns in your hand, or not. All right.
Now, as it's turning, it's okay to turn it back?
Yeah. Yeah. That speaks to the muscle difference here on the left side.
As you're reaching the top, it's okay
You're
to
supposed to
turn it out?
Oh yeah, it will naturally turn. Like,
slow.
No, I meant
Don't
to
hurt yourself.
counter it
You don't
out.
want to turn
Okay,
it.
fine. So that is active.
Yep. In that
Okay.
moment. Yes, exactly. Yep. You're trying to keep it turned out with your own. So, like I said earlier, the reason all these like you can kind of see what mobility you have in your shoulders because your shoulder is simply right ball and socket, but this ball that's the bone can get pulled forward in the socket or pulled back depending on your strength. And for most of us, it's pulled forward. We fight this way. I'm using a lot of my forward muscles to do the work to engage my hand. Does that make sense? And so when you have this, very commonly, you end up having some of the fibers get squished as you raise your arm. How many people here have felt shoulder pain that's been persistent for like a couple of weeks? For some sort of impingement? Years, all right? Right? So it's not like, it is not an uncommon thing. It happens a lot with lifters, it happens a lot with people who do combat sports. And the impingement is simply this no longer in the center. You need to strengthen the other side to pull this ball and socket back into place. 100%. Yeah.
For me, it's always the elbow.
Okay, that's different. Yeah, I thought a whole other thing was talking about that too. Always the elbow. And we talked about yesterday as well. It's like this is a chain of connection. So it might be loosening up the shoulders to get to the elbow, or it might actually just be here.
Also, in day-to-day life, people don't use their posterior deltoid. So look at regular people who don't fight.
Exactly.
It's all medial anterior.
Yes, correct. Yeah. But you have to work that posterior.
For it to be a sphere.
The thing where if I turn my hand like this, the shoulder, it doesn't like hurt. It just, I can feel it kind of clicking, popping around.
Yeah.
Whereas on this hand, it's fine.
Correct.
That's what so it's like, I think this is somewhere slightly out of it.
You have something grinding a little bit. And all shoulders aren't the same. We're all comfortable, slightly different. And so there's sometimes either traumatic injuries or such can cause that person to have to come. So, all right, let's test the other things. External rotation. Everybody, spears down. So this will be external rotation. You have your elbow in line with your two shoulders. Like imagine a line across my shoulders, your elbow's there. And now I'm just going to bring back, hitchhiker thumb. See how far back can you bring that? You can look around and see the differences. Like how well can you hold. That's it. You test the other side. Right? You can see who has tighter shoulders, who has shoulders that are a little bit more limp. And it's really good. Yeah, and if you start to find yourself leaning, that means you run out of the end of your chain, right? But it's only supposed to be in here. If you're leaning, you're not doing the thing. Yeah, listen to the differences, right? So, external rotation's another one that tightens up if I use your muscles in a certain way to do as well. And then let's try internal rotation. By same deal, going the other direction. Right? Imagine your elbow, shoulder, kind of in line. I go palm. Third time. All we're doing is check. Yeah, you can kind of see more. Yeah. Right? Yeah, exactly.
Look how far my hands
So, to work some of these things, right? We talked about it yesterday. You need both active and passive stretching. So if I wanted to passively stretch this, right? I can grab a rope, I can grab whatever. If I want to get creative, I can use my own leg and like get external rotation. Does that make sense? I can essentially arm lock myself and practice that stretch. But the other thing you need to do is work on it through active strengthening. So we're going to do that with partners today. I want to pass this around so people can try it. Grab a partner. So, and we'll let's come around so everyone gets a shot. I want you to practice. So all I'm going to do is just work on external rotation. Hold for 5. That feels pretty good. It's not that intense. You can always go here. Take a step back. Feel that intensity. Pass it around. Try internal rotation. Next to you. And we'll pass the bands along.
Master Bumi, for this particular exercise, working with a partner is the extended band that
working with the band is so this is for everybody. Working with the band is a little weird because it's exponentially tighter. However, bands themselves get looser with time. It's the nature of rubber, and so for those reasons, it's hard to like exactly replicate poundage. If that makes sense. So it is all about effort. Just like anything else, I talk about like gotta be intense. So you should be like this. It's not like oh, it's nice. It's like dude, yeah, you gotta push it. That's what helps with that. All right. So while everyone's playing with a little bit of bands, we're gonna talk about this is addressing everybody else as well. Oh, yeah, they're looking at it. It's just the work, right? They're doing exactly what they need to do to actively strengthen some of those ranges of motion. And so passively you can stretch it out, but then actively you pull yourself into that range of motion. You pull yourself into that range of motion. I look like Sir over there when I first started with my shoulder. Getting further and further, right? I'll take it.
Not worried I overstretched the
Yeah, you can feel it. You can feel those cramps, those knots. It just says it's tight. It doesn't want to be working at the end range of motion. All right.
All right, we're gonna pass it around.
Yeah, pass it around. Give everybody a shot. Have a partner. Play with it, please.
I guess I had to be close.
The biggest thing
It's never much. of course, I fought everybody there. Next day, drove to Chicago, fought everyone there. This is my first time trying it.
This is the good video.
This one, I'm like, this one's going to
We need to try this.
Sure. What's enough? Yeah, you try those same ones and then do the pound.
Try internal rotation, external rotation. Don't put that. Exactly, yeah. It's how you want to like lean your back into it. The goal is to think about like adjusting the side. It's the most natural to want to do the low back. Yeah. And I know this is suboptimal. Like I would like to do this for the yeah.
My ball. I got
Yeah. That's it. External rotation is the word. I would do something like a 10 by 5 and make it into. Yeah, absolutely. There we go. What's that?
Can we brace like our shoulder against the wall, your shoulder against the wall? Yeah, I'll brace this guy. Yeah. I've got the perfect spot. Yeah, I know what came out.
It's not tiny person. No. But I mean, like, there are some women here who are tiny.
Thank you for the partner.
You definitely.
Thank you.
Okay, take it. Yeah.
I like to go.
So then, yes, you probably know who that show is. Both of us. All right. We came from. Oh, I know who that show is.
Circle up. Who here has done fascia release? Anybody done trigger point therapy, fascia release, foam rolling, dry needling, any of those things? The idea is in your body, as you tear your muscles, right, and they rebuild. Sometimes they tear a little muscle, or sometimes you don't have enough protein or other protein in your body. Your body uses the minerals, the piece your muscles back together, right? Or sometimes there are other neurological factors that cause trigger points not. There's a lot of different words and a lot of different field things best. Like I said, everything from like dry needling to trigger point therapy, massage therapy, all address the same idea, which is there are times where your muscles have not set up and don't want to release. They have the capacity to, but there's something else keeping them from doing so. And so we want to do that a little bit today. One option that's relevant to what we did yesterday is using a foam roll. Like we talked about, if I don't have great flexibility here at this angle in my calf, I might look for a trigger point here in my calf. If I find one, I'll floss and work it out. What I'm looking for is simply going from pressure to like a fuck you amount of pain. It should be like, ow, that hurts. It's not something. So, what we're going to do is we're going to hand everybody a golf ball as best we can. And I want everybody to go. We're going to do it 2 different ways. So I'm going to demonstrate it here. I'll send you off to whatever space you can for this last activity. You're going to take this lacrosse ball and check. Right underneath your armpit, behind your armpit. Right here, side delt, shoulder point, front delt, and then the J, the line muscle coming down. Those are the and what I want you to, do is to find the post and drive that in. And then it's going to be a little bit. Hold this here for him. Yeah, so I'm very much stretching out those muscles, driving in, looking for those knots. Ow, this sucks. Okay? So
that's another thing. If you have a partner, you can probably do that.
My suggestion is grab one of the major tempos. I'm going to pass these out to whoever.
So what I did I did something like this, but I put a ball on a stick, on a piece of PVC tubing, and then
everybody a shot.
And then I would grind into the tubing.
If you haven't done this,
Yeah, and it gets some stretch, although you just have to be
I've
careful.
always also found though your armor
I had a problem with like all my scalp
and I'm very like,
It was after my surgery. It never freed up. And then I couldn't recover anymore. And I started doing that.
I'm aware of it. I just didn't know about the name.
oh yeah.
Breaks down all the calcium.
Everybody go find a post, a wall, or something.
Yeah, I've got one.
I just figure it scares your muscle. I'm not doing it again.
It's I do it for my thigh, and it'll lock up. Or it also works really well that if you're fighting and you're cooling off, you roll up and down your leg, keep it back up.
No, I needed a hip, and I thought it was the IT band, so I used my full hip replacement.
Full hip replacement.
I got both of them. It's great. Couldn't be happy.
Good.
After doing it, I started running again. So I've been biking and hiking.
To try to get all the tendons connected.
Right, because this is
Okay. Super.
Could be happier. Fighting against it.
That's super.
15 years off.
Okay.
Sure.
If you can cut it back,
Got it?
For those who want to get your lats position, you can also lay on the ground.
I thought my hip was an IT band, so I well,
Oh, yeah.
I was convinced no, it's not.
But now, yeah, no, IT band is just structure, right?
I have actually.
Well, it presented the same. You know, I tried Bursa. I mean,
Yeah.
it was presenting here, and it went shit.
Yeah.
It's weird. This one presented classically.
Yeah. The other side is different.
Can you do that one more time since I missed it?
Oh, yeah. Another way to roll out those big high lats, especially if you do a lot of pulling activity, just to lay down on your foam roller like so, and stretching out those fibers and checking them out. I'm fortunate enough to have done this a lot, so the knots are much less painful than they would be. Right, but they're still there.
Sure, of course.
It used to be like unbearable. I couldn't fall all the way down.
No, I was nauseous by the time I finished the IT band.
Yes. Yeah. That's it. You learn that your body has those knots, and you do the release work. And
You want to ask anybody if they have any questions? Specific muscles?
People off doing their
So, and no matter what, it is super useful for your knee. And you can see you could just paint them too. Is there any? Is that we're done? Okay, good. Yep, that's a good. Thank you.
You know what the next one is?
We're going to be, I think it's 1 o'clock, we're going to do the next layer of ladder drills. And so we're doing like 3 or 4 ladder drills at a time. This is